The governor, when in the press release talking about the money that had been wrongly sent to CCOs, talked about the great progress your team is making. The Secretary of State, in his announcement today about the audit, talked about the bad reputation and, in a sense, reckless spending. I don't remember his exact words. So where are you, if those are the two ends of the spectrum? I'm trying to figure out where the heck you are.
Well, I think inherently the Secretary of State's audit is a backward-looking exercise, right? They were looking at a point at a range of time in the past and opining on that range of time. I think the governor was speaking in the present tense, and I think we can demonstrate that we have identified significant issues that need to be addressed. I think we have worked very hard on. The governor told me focus on transparency, accountability, and wise use of public resources. And I think we're hitting on all those cylinders. I think we're trying to be very transparent. I would challenge you to find another agency that's out there pushing bad news out the door before it even really understands what it's looking at. I think we've made organizational changes to address some of those issues. And I think what we're trying to do is demonstrate that we care deeply about making sure that the dollars that are entrusted to us get used as effectively as possible to pay for doctor visits and hospital visits and surgeries and medicine and the things that people need to be healthy.
Is OHA, at least looking backward, an anomaly? Or what does this say about state government in general?
Oh, so I've raised this point a couple of times in the last ledge days. In my experience, OHA looks a little bit like a business startup. And yeah, it's a few years old, but a business startup is out there going gangbusters to accomplish its mission. In the case of OHA, adding 400,000 people to the Oregon Health Plan rules, saving $1.3 billion over 3 years in healthcare costs, transforming the state hospital from what it was to being one of the finest facilities of its kind in the nation, working on modernizing public health, all those kinds of big picture, what are we here for and what are we trying to do? And like a startup, when you're out there doing everything you can to get that stuff accomplished, a lot of times these business processes and those kinds of things get a little bit short shrift. And in the history of a startup, the shareholders often bring in a new CEO who is not the founder and not the visionary, but the person who's going to start putting structure around those things and operating like a business. In some respects, this agency is a lot like where we were before DCBS, where it's this agglomeration of kind of vaguely related functions. But DCBS is 25 years old and has had lots more time to develop that structure around it. That this agency really, I think, has been moving from crisis to crisis for a lot of time, and I think now we have an opportunity, if we can get through the current round of crisis, to build that structure. And back to why do we keep getting hit by lightning, see if we can't put in place the structures and systems and approaches that start reducing the crises.